Someone who's in the throes of anxiety, they avoid what matters to them most in the world, because the things that matter to us most are the things that provoke the highest level of anxiety.
For a lot of the people that I work with, anxiety shows up in this sense of not being safe being themselves, like sense that they are just not good enough and that they're going to be rejected. It just kind of trickles into all aspects of how they move through the world.
That fear and that shame, it's going to govern their lives. It's going to have a hold over them until they can take the step to really address it. Therapy is the place where you get to let that go. What makes Seattle Anxiety Specialists unique is that we've been able to bring together a group of clinicians that are really passionate about working with anxiety specifically.
The reason why therapy exists is it's really hard to do this type of work by yourself. Like if people could just do it by themselves, they would.
A therapist who's treating anxiety really needs to understand the cognitive and behavioral aspects that are really specific to anxiety. Things like negative reinforcement.
Things that will help ease that anxiety and offer relief in the short term are unfortunately the exact same things that can prolong suffering in the long term.
A big part of therapy is learning to see those patterns. One of the things that we've really worked hard to do here is to combine these rigorously tested evidence-based theories with a warm and inviting space where folks can come and really feel seen and really feel heard and form a connection with their provider.
I find that there's so much magic in being able to sit with someone through uncertainty, through their vulnerability.
Having someone else who's holding space, who's helping pick out these different details that are getting lost in the anxiety just tends to be a lot more effective.
Starting a psychiatric medication can be really scary. It can come with a lot of preconceived notions.
Pharmaceutical therapies today are a lot more effective than they used to be. They're not just like the medications of the 1950s that just pepper over the pain. These medications help patients become more flexible in their thinking and change those thought patterns, change those emotional patterns, change those behavioral patterns.
One of the first things that they notice is that the kind of circular thinking that was always so hard to get out of, they're able to kind of step back from that and think logically. It doesn't mean that it's all of a sudden gone, but they notice it from a different perspective, and that can be a really big relief.
We find that when we combine these newer medications with evidence-based therapy, the majority of patients will get better.
Therapy is a lot of hard work, but truly all the hard work that someone puts in, they get back. I've worked with clients for long enough to watch them transform their lives from difficult spots, struggling, to being confident people who like themselves.
When someone is able to overcome anxiety, they come into a sense of freedom. They're able to navigate the world without laboring under this tyranny of shoulds and what ifs. Suddenly, they're able to do things that before would have stopped them in their tracks.
The fact that you're acknowledging that something's going on, that you might need help, that is really courageous.
That's where change is possible, is when clients take that step for themselves.
We know that there's hope. Folks can get better. It's a tremendous honor to help patients reach that potential, to overcome that, to lead the lives that they really want to be living.